Hello, everyone. Thank you for being here with us today as we learn more about how local jurisdictions in Texas can build resilience using the composite of post-event well-being, or the COPEWELL framework. This framework is incredibly useful to help plan, adapt, and recover from public health emergencies in Texas and beyond. I'd like to welcome each of you and thank you for joining us today. This is a really knowledgeable and diverse group. We have people representing all aspects of public health, nonprofits, emergency management, library and information sciences, and several other critical community-related organizations and individuals. Community resilience requires collaborative partnerships across a wide spectrum of people who have the knowledge, expertise, and willingness to help their communities build resilience before, during, and after a public health emergency. Sometimes resilience means working in uncharted territories, and oftentimes it means working in the face of adversity without resources that are critical to be able to build resilience. In Texas, resilience requires a wide coalition of partners in each of our 254 counties across the state. Each county has unique and specific challenges that they have to work across to plan and execute programs that can help with resilience when public health emergencies occur. Not only our geography, but also differences including different infrastructures, lack of access to a hospital within the county, healthcare shortages with personnel, broadband access, and many other factors. So COPEWELL is a meaningful tool to help communities build resilience, and we are thrilled today to share with you, along with our partners, this tool as something that can potentially help your community in the face of adversity. We want to be able to more efficiently and accurately prepare, mitigate, respond, and recover when public health emergencies occur in Texas and beyond. We know in Texas we have our share of disasters, from hurricanes to winter storms to ongoing pandemic issues. Now more than ever, we really need to come together to holistically assess our communities and understand their functioning, what works, what's available, and what do we need to do in advance to minimize the damage of these events when they are inevitably going to occur. Before we go much further, I'd like to thank our co-sponsors for this event. First, I'd like to thank the Texas Rural Health Association. We know in Texas that rural health is a critical issue right now. Many of our rural counties are struggling in the face of the pandemic with a lack of resources that are necessary to help build resilience. I also want to thank the Johns Hopkins Center for Health Security, who is our partner and who is the author and lead for all things COPEWELL. You'll be hearing from many of the people who have been responsible for developing this tool today. Johns Hopkins Center for Health Security has been a leader in applied research that produces actionable recommendations, and the COPEWELL tool is a great example of that. Similarly, I'd like to introduce myself. I'm Melinda Villagran, Director of Texas State's Translational Health Research Center. At Texas State University, we too are very focused on applied research that's actionable and that helps our communities to build resilience and health and have long and economically prosperous lives. As a center, our goal is to translate and share research to make sure it reaches the people who can actually benefit from it. I'd specifically like to thank the team that has worked on this event, Rex Long, who is our liaison with Johns Hopkins Center for Health Security and a doctoral research associate, Emily Repasky, who has recently joined our team at the Translational Health Research Center working on the resilience research team, and Jessica Schneider, who has been instrumental in this event from the beginning as our Director of Research Programs that focus specifically on resilience and building healthy people and places in Texas. Thank you to each of these people for making the event possible, and thank you for joining us. I'd like to turn it over to Jessica to introduce the agenda.
All right, thank you, Melinda, and good morning, everyone. First, as a reminder, this webinar is being recorded and it will be available on our website after the event. So do feel free to share the recording with others who may have been unable to attend and join us today. To walk you through our agenda, after we conclude our introductions, we'll hand the session over to the COPEWELL team at Johns Hopkins University. We will hear from Dr. John Links, Dr. Tara Kirk, and Dr. Monica Schoch-Spana, who will provide an overview of the COPEWELL framework, including its core concepts, its system dynamics model and data dashboard, self-assessment and implementation tools, and resources for change. Once these presentations conclude, we'll move into our Q&A, where you all, our audience, will have the opportunity to ask questions of our panel. Please submit your questions using the Q&A feature in Zoom, which you all should see at the bottom of your screen. You may submit questions at any point during these presentations, so definitely do so as they come to mind. We'll collect and answer as many as possible during the Q&A. Lastly, we will conclude with a few reminders and closing remarks, and that will wrap up day one of our town hall. Now, before I pass it over to the Johns Hopkins team, we want to ask you all, our audience, a question. We'll ask this question now, and then again after today's presentation, to gauge whether learning about COPEWELL results or sparks any change in thought. So we'll share these results, the results of this activity, in a word cloud on Thursday during day 2 of our town hall. So in a few words, and truly 1 or 2 words, what factors come to mind as necessary for improving community resilience to disasters? So everyone, will let y'all have a few seconds, a little bit of moment to think about this. And again, 1 or 2, what are the 1 or 2 words that come to your mind right off the bat? And you can keep, let's see, yeah, y'all are doing great. All right, please feel free to continue submitting your answers. And thank you for participating. We're very excited to see the results of this. And now I will hand it over to the COPEWELL team.
Hi, folks. I'm John Links. I'm a professor at Johns Hopkins and the university's chief risk officer. And I began as the principal investigator of the COPEWELL project. And I'm here today with my colleagues from the Center for Health Security at Hopkins, Tara and Monica. And the 3 of us are going to introduce you to COPEWELL. So I'm going to start just by telling you what in the world COPEWELL is, giving you a sense of the conceptual framework, and then Tara and Monica are going to take you through the website and some of the tools and how COPEWELL can be used. So we like to think of COPEWELL as a decision support environment to help communities understand and strengthen their functioning and disaster resilience. COPEWELL was developed by 2 centers at Johns Hopkins, the Center for Public Health Preparedness that I direct, and the Center for Health Security, along with the University of Delaware's Disaster Research Center. The effort started as a pilot project within a CDC-funded Preparedness and Emergency Response Research Center that I direct at Hopkins, and then progressed with specific funding to Hopkins over a 12-year period to further develop and apply COPEWELL. Of importance, COPEWELL's environment and toolkit is contained within a publicly accessible website. So accessible to anyone, no registration required, etc. Everything's free. And that's at www.copewellmodel.org. And this website is intended for stakeholders to use it without the need for technical assistance from us. And the website consists of 4 main elements that Tara and Monica will take you through: a conceptual framework that permits stakeholders to understand the elements of resilience in an accessible whole of community way, a computational model that predicts and visualizes community resilience using a common set of publicly available measures collected at the county level. So every county in the nation, which of course includes every county in Texas, is represented in that computational model and the visualization maps. A set of self-assessment tools, we call them rubrics, and support materials to permit jurisdictions to rate strengths and weaknesses and develop an action plan for driving improvements. And then a curated set of exemplar interventions that are tied to the elements of COPEWELL. Now, the conceptual framework and the computational model have been validated through both case studies of historical disasters and specific quantitative validation approaches. And the self-assessment or rubric approach was developed and refined with stakeholder partners, including local communities and practitioners. The entire website, as a website, has been vetted by a series of jurisdictions, and we're currently using that stakeholder feedback to ensure that COPEWELL and the website are usable and sustainable over the long term. And as we work with all of you, we're looking forward to hearing back from you along those very same lines. Now, as we go into an explanation of COPEWELL, we want to emphasize that it really differs from previous work on community resilience and community resilience modeling by addressing key knowledge gaps and practical operational challenges. So in particular, early efforts to measure community resilience were deficient in assuming that resilience can be directly measured in advance of a disaster. In truth, resilience is a latent property. It only emerges when the disaster hits. And our model is the first to describe resilience this way. Earlier efforts use a static approach to resilience as though we're a static phenomenon, while we properly treat resilience as a dynamic phenomenon, and we use system dynamics computational modeling as a result. Of real importance, prior models tended to conflate pre-event or pre-disaster community functioning with resilience. And it led to the often incorrect conclusion that communities with good baseline resources are automatically resilient. So we separate baseline functioning from resilience, separately assess each to understand where the strengths and weaknesses lie. We also separate resilience into its two major components, namely resistance and recovery, to make these distinct phenomena more explicit and easier to identify weaknesses and the potential interventions that tie directly to addressing those weaknesses. So why don't we start by taking you through the computational framework, and perhaps Tara or Monica can share the screen. So here's the COPEWELL framework, and Monica, if you, or Tara, if you just scroll up, that's great. So we use a metaphor of a liquid flowing through a series of tanks to describe the conceptual framework for COPEWELL. And in this metaphor, the big central tank filled with blue liquid represents community functioning, and the level of that liquid in the tank rises and falls as community functioning increases and decreases. So first look at the very bottom of that figure where it says event. So some sort of event, and that's a generic term we use for any sort of disaster. It could be a natural disaster, it could be a pandemic, it could be something that's short-lived, something that's prolonged, it doesn't matter. An event impacts the community. And you see a vertical arrow pointing to a circle with a cross in it. And that circle with a cross in it is a valve. And the event opens that valve, draining community functioning as a result. And that draining of community functioning is reflected by a fall in the level of blue liquid in that tank. Now, if nothing else happened, that valve would stay open and that community functioning blue liquid would be completely drained. But there are two very important things that happen. The first is there's a series of what we call resistance factors that resist the opening of that valve by the event. And you'll see that those resistance factors are a combination of population factors, such as vulnerability, inequality, and deprivation, and prevention and mitigation factors, including natural systems characteristics, engineered systems characteristics, and the traditional countermeasures we talk about all the time in public health. And so depending on the particulars of those factors in a given community, they work to resist more or less the immediate impact of the event in draining community functioning from that community. But inescapably, some community functioning is lost. That is, there's a decrease in community functioning during the event and during a recovery period afterwards, with the goal of recovery being to once again reach, at a minimum, the pre-event level of community functioning. And so you see at the top of the diagram 4 main boxes, also holding blue liquid, governed by a series of valves, the circles with the X's, that when those valves open, blue liquid goes into the main community functioning reservoir, thereby replenishing community functioning. And so those 4 boxes at the top represent recovery factors, things like social cohesion, which drives emergent collective behavior on the part of the community, formal preparedness and response activities, external resources, for example, as introduced by the federal government or by the state to the counties, and then resources for recovery that exist within that particular community or in neighboring communities. And you'll see there's a bit of a feedback loop from the level of community functioning as it varies over time to those valves, because the way the model works, just like the way the real world works, is that the greater the impact of the disaster, that is, the greater the loss of community functioning, the more those valves open and the more replenishment liquid or community functioning flows into that main community functioning reservoir. Now, there's one final area of this diagram, and that's the one to the left of the community functioning reservoir, and that's labeled pre-event functioning. And you'll see there's a series of domains that characterize the community's pre-event functioning. And we conceptualize a community as providing goods and services to its inhabitants. And so those domains of pre-event community functioning characterize how well that jurisdiction is taking care of its inhabitants in a routine way. Now, taking a step back from this diagram, 2 main points. The first is that you'll see that we conceptualize community functioning and resilience as modeled by resistance and recovery as distinct. So we do not conflate pre-event functioning with resilience. We further separate resistance and recovery factors as the two main components of resilience. And we further focus in both conceptually and in the computational model that follows this diagram on the predicted time course of community functioning during and after a disaster. So what you really want to know is, during a disaster, what's happening to community functioning? And then during a recovery period, how is it being restored? And so we produce these curves of the time course of community functioning during and after a disaster. And from that, we can derive color-coded maps of pre-event functioning, resistance, recovery, and resilience. And so at the end of the day, you can look at the color-coded maps, or you can dive down deeper into these different domains of the model, and ultimately into the individual measures or indicators that drive for each county in the US the quantitative assessment. And then, of course, we have the other elements of the website and toolkit I alluded to earlier. So with that, I'll turn it over to Tara and Monica to give you a bit more detail on all of this.
Well, thanks for that, John. I'm gonna, for my presentation, I'm going to keep sharing the website and kind of explain where different things are and what you can do with them. And then Monica will go into the self-assessment tools. So when you come to our website, you see the different components that we talked about. We were just looking at the COPEWELL framework. You can see here, this is the link. There, actually, if you want to go into more depth on what's going on there, you can actually click on each different section and it will pop you over to a little bit more of an explanation about what's going on in each spot. And if you're not sure where to get started, we also have this getting started guide, and it can kind of walk you through what parts you might want to focus on, how to think through it, different resources for just getting started. And I'll also note that there are videos up here that you can that you can go to and check out and see how other people have used it. And you can also, we'll be adding a few more details to get some examples of how this has been used in the past. But I want to focus here. Well, I'll mention Monica will be presenting about the self-assessment tools, and those are right here in this yellow box. It comes with both the rubrics and this really great implementation guide. Many people go straight to the rubrics and forget that this is here, and that's a great resource for people who want to start using that. But here I'll go into the computational model and give you a little bit of a tour of what's going on here. We have the summary of the measures here. You can link to that, download that. We are also updating this because we just did a big data refresh, and I get to show you actually the results of that. But you can see here we have this color-coded map that John described. And if we go to Texas, we can get a little bit of a closer look at what's going on in Texas. It takes a little while because a lot of math is going on in the background. And we can sort of focus in on what's going on. And there's some different explanations. But I'm going to hop over here to our hidden background site for the updated data. This is updated as of October 9th. So it's all fresh and new. And we can look through model outputs. Here's resilience, which are the two resistance and recovery put together. But you can also separate it into recovery outputs and resistance outputs. And we can also look to see what's going on inside the model, right? We can look at what went into the model, what went into those judgments or that output. And so one of my favorites is to look at healthcare and public health. A lot of people get focused on hospital beds. This is a big concern. And so here we have number of hospital beds per 10K population. And this sort of tells us where we are on that measure, which goes, all of these measures go in and help output our total value for community functioning. And there are other pieces here, social capital and cohesion. This is something for you to play around with, and it's a great way to get conversation started. Or other people have used this as an opportunity to think through if they need a framework and starting numbers for grant applications or for making decisions about grants. This can be very helpful in providing that narrative. Even if you disagree with the outputs, having that discussion with the stakeholders, and this will go in a little bit into what Monica is going to describe, but that can provide you with an opportunity to talk about why you think your value might actually be different than what these measures will show you. And you can get a little bit more into the specifics of each measure by clicking on these types of outputs. You can get a little bit more into where the measures are coming from with that other measure table. And so that's what I've got here for you on the model. John, I'm just going to ask you, did I miss anything? Is there anything that you think that we should add here for this conversation before we go over to Monica?
So I'll note that first of all, this is a lot of drinking from a fire hose, I'm sure, as we present what is really a pretty comprehensive website and environment. Again, it's designed so that you can go through it at your own pace, and in theory, you don't need us to explain things because everything's explained within the website. For example, even on this slide, you'll see there's two possibilities for scales. 0 to 1, which is an absolute scale where 0 is 0 and 1 means perfection for whatever you're looking at. And then a second way of scaling the data, min to max, that makes smaller differences from county to county more apparent. And all of this is explained on the website itself.
Thanks, John. One other thing also that I wanted to note is that you can also get these values in graph form, kind of comparing county to where everything else is in the United States to where things are in Texas. You can also pull out a table of all the measures and look to see what's going on all the way across. So with that, I'm going to stop my share and I'm going to pass it over to Monica to describe the rubrics and self-assessment rubric, or self-assessment rubrics.
Thanks, Tara, for that introduction, and thanks, John, for that overview. It just really underscores, even for me, a team member, how powerful these tools are. I'm going to share my screen to discuss the rubrics. So as John indicated, the rubrics really are a measurement tool. Consider them a ruler. What we've done with these particular resources is to translate 19 domains into 5, which I'll get to. I think what's great about COPEWELL is, like, it gives you the science and it gives you the social side to strengthening resilience in your community. You have to think of modeling not strictly as, whipping out a ruler. It's a person-to-person type of activity. And if you do measuring in a group, what it helps you do is, particularly around community resilience, is move from this very abstract construct relative to a low probability, high consequence event to really concrete phenomena that you can change, affect, alter. What COPEWELL is really good at, as both Tara and John pointed out, is giving people a shared language, a common point of reference. It's a way that people can talk about something abstract with others who are new to the idea. It's a tool. Measuring together helps with strategizing and decision-making. You can decide as a group, where should we begin? What will we only have limited resources? What is our biggest issue? What's our biggest challenge, or what would give us the biggest bang for our buck? Also, COPEWELL, both the computational model and the rubrics, can serve administrative and motivational purposes. You can monitor, evaluate, and celebrate progress. So I think it's helpful for people to think about the rubric and the computational model as complementary to one another. They each have pluses and minuses. And so, jointly applying them really gives you a lot of power in terms of strengthening resilience. So with the computational model, which both Tara and John walked you through, you might think of it as sort of a top-down process. And so you've got these externally validated indicators and standardized data that enable comparison between common units of analysis. And in the case of COPEWELL, it's counties. And counties can get into some friendly competition. How does Travis County versus Williams County, so you can compare county to county. A key strength of the computational model is its objectivity and its consistency. So where it has a deficit, where the rubric can pick up is the fact that it's focused exclusively on the county. So you can't talk about neighborhoods, and you can't talk about 1.5 counties. And so we also don't have data that's very meaningful, that fully captures how the designers have defined the domains. So the rubric tries to fill those gaps. You can consider it more of a bottom-up measurement, because people in a on the ground local jurisdiction, however you want to draw the outlines, engage in a participatory collaborative process and generate their own judgment of where they are relative to factors affecting community resilience. So things that are meaningful for them and their community are more easily integrated into the use of the self-assessment rubrics. And as far as motivation, once you set a baseline for yourself, you can, by implementing the rubric again at another point in time, see how well you're doing. So the motivation is really about comparing yourself to yourself once you've taken some interventions. Now, there are some limits. Let's say, the people who inputted their ideas about rubrics in 2022 are no longer there. In 2025, different data sets in the meantime have become available. So the downside is a potential lack of consistency if the personnel who are implementing it and the rationale they exercised is different. So, as I mentioned, what we've done is take what I think a total of 19 domains, which is a lot of things one would have to measure, and distilled them down into 5 significant domains. So we've got the principal concern of community functioning. For resistance, we have population factors and prevention mitigation factors. And then for recovery, we've got 2 components of social capital and cohesion and emergency management, more from a formal systems perspective. So our collaborators at the local level said, we can't apply 19 different rubrics. It's too much time, it's too much personnel. So we really tried to focus in on making a end-user friendly set of rubrics. So what is a rubric? A a rubric is a measurement tool. And so what we've done for those 5 domains is produce a worksheet that people can use in the context of a workshop. And it consists of a variety of components. First is a formal definition of the domain, so that everyone who's around the table is talking about the same thing, because they're thinking in a common set of reference points. So for social capital and cohesion, that's factors that help society function effectively, including social networks between individuals, neighbors, organizations, and governments, and that degree of connection and sense of belongingness. So that's one of our 5. But we've, again, tried to break down what is abstract into more concrete things. So we also define subdomains, and we break down social capital and cohesion into connectedness, right? The ability to pull together, that sort of social glue factor, and then community involvement. All the different ways in which people are participating in community activities, whether it's at a place of worship or in the voting system or neighbor to neighbor. So we define, again, those subdomains. So people have that common set of reference. Now at the workshop, what you can do is use what we call prompting questions to really push people to think about, okay, how do we rate in terms of this capability in our community? And these questions, like, for instance, do people in your community know, trust, and support each other? You can say, hey, what do you think about that? Because this affects our connectedness. And people say, well, I think we trust each other. I think there's a lot of mutual support. Then you can say, okay, well, how do you know that? And then at the workshop, people are then encouraged to back up their assessment, either by pointing to a report that says, people feel great about this, there's a strong sense of identification with our community, or they see things on a daily basis. And both of those types of data are suited to this type of self-assessment. So we have these prompting questions that you implement in the context of a larger workshop. And as Tara said, you've got these very specific 5 measurement rubrics. Each one of them has a moderator guide. You are not left on your own in terms of how to implement or put into place a process for the use of the measurement tool. We're there for you. We say, hey, this is the kind of stuff you want to have in a room, a whiteboard. You might think about inviting these types of people to the table because they have the kind of information you need. So we give you guidance on the process as well. And that's in the moderator guide. Apart from the prompting questions, we also have tried to give people a description or a vignette that represents a jurisdiction that has, great or optimal capacity as it relates to a particular domain, in this case, social capital and cohesion, or one that really could improve, because we found that these narratives or stories help people imagine the 2 ends of a continuum and where they might fall between low capacity and optimal capacity. Parts of the rubric that are not represented here are a place where you can write down what supporting data people are providing, and also things to put in a parking lot, like things that are important that came up in conversation but aren't relevant specifically to, in this case, social capital and cohesion. So again, COPEWELL gives you the science and it gives you the social process. So it's helpful to think about the rubrics or the self-assessment, not just as using the ruler, but about that interaction capability. And so you can think about the application of a rubric as part of a visioning, planning, and acting cycle. So one, you kick off with that common language and common points of reference. You engage in a collective assessment. You talk about, okay, we could do better here, we could do better there, where do we want to start? You can then develop an action plan and say, okay, nonprofit groups A, B, and C are going to tackle this subdomain. Once you have outlined your plan, you carry it out, and then you can monitor and evaluate, and also celebrate success, celebrate progress. So a communication campaign is a good component. So I kind of went through the concrete parts of the rubric itself. So let's talk a little bit about an action planning workshop. So here the prompting questions are about moving forward, about strengthening the factors that influence resilience. So once you have your assessment output, let's say we rate 6 on a scale of 0 to 10 for social capital and cohesion. And then you look at where you are in terms of social connectedness and community involvement. You can say, okay, where do we want to make change first and why? Is this a really great need? Is it a tractable problem? Is it low-hanging fruit, for instance? Is it a broadly shared concern? Is it aligned with our values and are beneficial in many ways? So you help people prioritize according to a number of criteria. Once you've developed your priorities, you can then talk about, okay, can we build on what we're already doing, or do we need to start something new to strengthen this particular aspect of our community resilience? Then you get to, okay, whose job is it to implement the kind of action items we're talking about? And you can set milestones and time frames for people, and use those milestones and a larger campaign process or communication campaign process to really get the word out that community resilience is a priority. We are doing something about it, and here are the particular actions that we're taking. So I really want to encourage everybody to come to day 2 of the town hall, because you're going to hear from local users about how they have adapted and applied COPEWELL in their own backyards, because I think that firsthand experience from out of the horse's mouth is very important. So Chester County was one of our early collaborators. It's in southeastern Pennsylvania. It's a very well-resourced county, but there are pockets of low resource areas and pockets of dense populations of underserved groups. So what Chester County did was use the COPEWELL framework initially as a way to gather all the various entities and organizations that were working on things that fall under the umbrella of resilience, but they didn't quite know each other or why their work should be connected to one another. So the framework brought together people who thought about disaster management with the people who were worried about everyday things like housing and water and healthcare delivery. They then applied the social capital and cohesion rubric, calling together community or county level agencies so they could set a baseline. But they knew that if you get down to lower geoscales, that there are higher and lower rates or levels of social capital and cohesion. So they also applied it in a municipality where there was a large number of marginalized groups. And they also did emergency management. Twin Ports, which is Duluth, Minnesota, and Superior, Wisconsin, use COPEWELL in a different way, where They use both the computational model and the self-assessment rubrics together. So the first thing they did was, in order to, as Tara was talking about, get people started to talk about the goal of strengthening community resilience, they used the computational model to generate those beautiful colored heat maps that allowed different counties in that region to compare themselves one to another and say, we could do better here, we could do better there. Then they took the rubrics, which we had originally thought would be applied in a workshop environment. They took our prompting questions and created their own survey so that they could really reach out to a large number of organizations, both private, public, and nonprofit, in the region of interest. So that was a different way that you can use the prompting questions, and that gathered in more information. And then they convened a self-assessment workshop. So they had these 3 data streams focusing on areas of interest. And by triangulating all that data, pulling it all together and see where things overlapped, they were able to find what their recurrent concerns were and to identify where they wanted to start taking action. So with that, I want to turn this back to, I think at this point, it's Emily Repasky. Is that correct? I'm going to stop sharing, and John, Tara, and I are here to take questions from you.
Awesome. Thank you so much, Monica. Hello, everyone. My name is Emily Repasky. I'm a research associate at the Translational Health Research Center. I'm going to be moving us into the Q&A session for today. So first and foremost, thank you so much to Monica and Tara and John for their presentations. Those were fantastic. So I'm going to take some questions from the audience first. So if you haven't yet, and please enter any questions you have in the Q&A box, Q&A feature. We'll try to get as many as possible. The share team has also prepared some questions as well, should we have time. So let's see, the first one that we have, and Monica, you addressed it in the Q&A feature already, but there was a question that you answered, if there's any plans or if it's feasible to replicate COPEWELL in other countries or regions. And you mentioned that the CDC has funded this model specifically in the US, and that the computational model is fed by the US county data. But do you have any suggestions on how the COPEWELL tools might be adapted to other areas where there is a lack of this computational model data?
Well, I'll start with the self-assessment rubric and then hand it over to John and Tara to talk about what could be possible. So the the conceptual framework, as John was outlining at the beginning, really is fed by the latest and greatest science, as well as expert judgment about what are those factors that are critical to understanding community functioning, resistance, and recovery. So John can talk about its applicability in other contexts. So I see flexibility there, but specifically with the rubrics, again, they're fed with, they were created like social capital and cohesion by our review of the literature about what it is that affects or social capital and cohesion, what it's comprised of. So I think that the self-assessment rubrics, which tried to fix the limits of county level single geoscaled data, could be applicable in other settings. And I'll let John and Tara speak to the computational and the mathematical side.
So as Monica said, probably the most important thing to convey is that we started with a blank piece of paper and thought at the conceptual level before the computational level. And at the conceptual level, the way we identified factors that drive community functioning and resilience was to look at the worldwide disaster literature, so the historical disaster literature, as well as the resilient science that's out there. And we had no intention at the conceptual level of limiting our work to any particular geographic scale or any particular geographic region. So the conceptual framework is meant to apply anywhere in the world, and it's meant to apply at any geographic scale. So it's meant to apply at a country level, at a state or region level, at a county level, at a city level, at a neighborhood level. And so we believe the conceptual framework applies everywhere. That automatically means, as Monica indicated, that the self-assessment tools apply anywhere, because they too are not geography dependent. It also means that the resources we've identified on our website as exemplar intervention strategies to build functioning and resilience also apply. The only thing that is very, very specific is the data that we show from the computational model. The computational model as a model, just like the conceptual framework, could apply anywhere in the world and at any geographic scale. But we've chosen to populate the model with US county data. And so that's what's shown, and that's all that's shown. We have, in separate projects, done things at a finer geographic scale, for example, with New York City. But on the website, it's county level quantitative data driving the model and the map visualizations.
Thank you.
And I think I'll just add that, even though those are at the county level, sometimes even if you're not, talking about the county level, you can still use that output to then start you off on the discussion that you're having for the using the rubrics or others. So, even if it's not that level, it's still a good piece of the story there.
Okay. Yeah, thank you so much. Just to kind of follow up, I have another question from the chat that says, or from the Q&A that says, are there any plans to adapt the model to look at census tract level data specifically?
So right now we don't have any plans to do that. And one of the things that of course we're always open to in terms of a discussion is if a particular jurisdiction wants to work with us to do work at a different geographic scale. The challenge that we've found is that the county is the finest geographic scale where we could represent the entire country, which is what CDC asked us to do, and have measures or indicators that cover all the domains of the COPEWELL conceptual framework. When you go down to the census level, two things happen. The first is that you don't necessarily have indicators for everything you want to represent. And the second is, in many jurisdictions, the census level isn't what that jurisdiction is accustomed to thinking at, but rather, for example, a community statistical area, CSA, a neighborhood, something like that. Here in Baltimore, where we're based, Baltimore City often represents the social determinants of health with 55 contiguous CSAs or neighborhoods representing the city. And so we prefer to work with a jurisdiction to use what to them is a natural way of breaking up that jurisdiction, and to see if they have data that they themselves have collected at whatever that more natural neighborhood or CSA scale is, to depict things. We don't think a census tract is automatically the best way to represent the country. And we know in our own work, we couldn't adequately represent the completeness of the COPEWELL model across the country at a census tract level.
Okay, that definitely makes sense. Thank you. I'm going to move on to another question that I received. So it says that you all mentioned that COPEWELL is used to assess resistance and recovery to prepare for future public health emergencies, but it seems like preparedness might be split off from the equation. Can one of you clarify, or some of you clarify, how COPEWELL can be used to include preparedness, especially as those in public health emergency management departments are important to preparedness and recovery efforts?
Great question. So first, let's talk a little more about these concepts of resistance and recovery. And I like to think about a hurricane and a tree. And resistance is the ability of that tree to not bend in the first place. And while recovery is the ability of that tree, if it bends, to spring back to its original upright position. And it's really the combination of resistance and recovery that you want to build in any community. So you can think of resistance as governing the initial drop of functioning and recovery governing the return of functioning after a drop. And so it's two halves of a coin, all about resilience. And the reason you think about them separately is because one set of factors contribute more to resistance and an entirely separate set of factors contribute to recovery. Now, if you think back to the conceptual framework, that diagram we spoke about at the beginning of this session, formal preparedness activities are part of actually the recovery phase because they tend to build recovery capability ahead of time. So point number one is that formal preparedness activities are flat out an official part of the COPEWELL framework and model. They're not separate. But point number two, and something that just gives us a bit of humility, is that thank you very much, is that if you think about functioning and resilience, you have to take a whole of community approach, and you have to factor in a number of considerations that go way beyond public health preparedness, go way beyond public health, and encompass the whole of community. One of the things that was unexpected for us, but maybe in retrospect, we should have expected it, was that as we started working with jurisdictions and multiple agencies, NGOs, and community groups were represented, the approach we took, everyone could see themselves somewhere in the model. And so talking about resilience and community functioning the way we do via COPEWELL actually has this integrating function in the community. And one of the things that we count as the biggest benefit of going through an exercise like this in a jurisdiction is that when you do the sorts of sessions that Monica described, people meet each other for the first time who ought to be talking to each other across agencies and other groups, and begin to build a shared vision of how to enhance that community's functioning and resilience. So all of that. Now I want to touch on one other point. We very specifically use the word disaster, and indeed we often use the even more general word event, rather than the word emergency. And sort of from classic public health preparedness definitions, an emergency is something that is within a jurisdiction's ability to handle with formal emergency management, that is preparedness and response activities. And for something like that, it's not what we're talking about with COPEWELL. What we're talking about are more significant events, disasters, that outstrip a jurisdiction's formal emergency management capabilities and capacity, in which you truly need a whole of community response in order to pull out of it properly. And so things like social cohesion, which for us is really just a proxy for emergent collective behavior on the part of regular citizens in the community, and that behavior that is integrated and cohesive, but only emerges upon the disaster, is exactly the type of extra help that formal emergency management needs in a true disaster that outstrips capabilities and capacity. And so that's what COPEWELL is really focused on, not the easy stuff, the hard stuff.
Thank you for the clarification and the thorough response. I like that you emphasize that the whole community aspect of COPEWELL and how that's important. And I have some questions about that as well to kind of dig a little bit deeper in how other players can help assist in these efforts. But I did have one other question just come through the Q&A that is about the computational model. It says, are the variables that go into the model weighed equally?
So the way the model works is that at each subdomain, at the lowest level of collecting measures or indicators, the measures or indicators are weighted equally. But then the subdomains are weighted equally, and the domains are then weighted equally in a system dynamics sense. What it means is, at the end of the day, that the measures are not all weighted equally because there's a variable number of measures per subdomain and a variable number of subdomains per domain. And so it's a equalizing function, the way we roll things up. But at the measure level, everything's weighted the same. Now, a word about that. We spent a lot of time, both with experts and with mathematical analyses, to understand the behavior of the measures. And when we first started doing this, there were a number of measures across different domains that on their face and to experts seemed like logical measures or indicators to represent a given subdomain or domain. But when we analyzed the mathematical behavior of those measures in relation to the other measures of that same subdomain or domain, those measures behaved wacky. That's a technical term. And they behaved wacky either by having no correlation whatsoever with the other measures, so they just added noise, or they could behave in a way that was counterintuitive. We would think a higher value equals better, and what we found was a lower value equaled better compared to the other measures. And so when measures behaved wacky, we did not use them in the model because they would basically corrupt the model in a mathematical sense. And so under the hood of the model is a lot of measure analysis and validation, leading us to the final set we're using.
Okay, thank you. Yeah, that makes sense.
Emily, I just want to follow up. I think how this is connected also to the implementation of the self-assessment rubrics is that as a community comes together, or a subset of its leaders, they can together weight things in a way that is locally meaningful. So their demographic composition, and again, just making this up, let's say over the past 5 years, they've had a very large influx of immigrants who don't speak English. And so the community wants to make sure that their self-assessment takes that factor into account. So those elements they can weigh in ways that they believe is important according to their geography, their demography, and the social values that are inherent in the community. So I just wanted to put that out there. There's flexibility there for locally meaningful aspects of resilience.
Fantastic. Yeah, I think that answer really moves us towards the topic of adapting these COPEWELL tools. It seems to be like a really prominent feature of COPEWELL. So my next question is, as you all know, we have representatives here today in attendance from lots of different backgrounds. So we've got people from emergency management and public health, but we also have representatives from various community engagement groups, like VOADs and long-term recovery groups, libraries, foundations, all of these community organizations. So how could these organizations potentially assist a jurisdiction in implementing COPEWELL? If you could provide some examples.
Let me start off and then turn it over. So I'm just going to pick one, faith-based organizations. And so we've worked with a lot of faith-based organizations, and in fact have developed workshops and guides to the faith-based organizations building their own emergency plans. And those emergency plans are not exclusively for the congregation, but are for the community in the context of what the faith-based organization can bring to the community and offer it during a disaster. Of importance, those workshops are meant to be partnering activities where the workshop is co-sponsored, co-led by a faith-based organization and a public health department, an emergency management function, etc. And so going back to the philosophical basis of COPEWELL as a whole of community affair, we think the way to cope well as a verb, a community, is to gather together all of these different types of organizations. Now, as Monica used just with two different examples, sometimes the lead is taken by a jurisdictional agency, but sometimes the lead is taken by an NGO or other community group. And it just doesn't matter. The point is to get people together.
Yeah, so I mean, that was basically what I wanted to say there, that it's not always that the community organizations have to help the jurisdiction do it, but that, you know, that they can take this on themselves as something that they want to do. So we do have the New Jersey VOAD who has worked with us in this last period. You know, they took on COPEWELL and decided to work using COPEWELL with different groups within the New Jersey VOAD, you know, grouping in different ways, using COPEWELL to think through different ways that they wanted to sort of organize themselves and think about their response efforts. And so I just wanted to sort of emphasize, look, if you're a VOAD, you don't have to wait for someone else to do this. You could take the leadership yourself.
Thank you. Are there any other thoughts, Monica?
Yeah, just a couple of other concrete examples, because I think the more people hear the stories of application, the more they can see themselves as using COPEWELL. And Tara pointed out that there are videos on the web, more to come. And again, I encourage people to come to day 2 of the town hall where you'll get to hear from users. I sort of rushed through the Twin Ports example. The group that was championing the use of COPEWELL there was the Duluth Superior Area Community Foundation. And they found COPEWELL and said, this will help our new initiative, which they called Ready North. And that was a collection of agencies and resources to support the Twin Ports community around disasters, but with a very specific focus on marginalized populations, because the people or the groups that comprised Ready North were by and large social service agencies. So they took the lead there because they were worried about, well, based on recent experiences, about the disproportionate impacts of, I believe it was a winter storm on their marginalized populations. So in Twin Ports, it was the nonprofit sector who used it and then brought in other people. In that conversation, transportation was where they ended up, where they thought, here's where we can make the most difference. If we improve transportation, we can get people to, they can improve healthcare access. We can get people to their jobs, you know, and so there, and we can create a better infrastructure that's resistant to impacts. Another concrete example was some public health and social science researchers at the University of Alabama out of Tuscaloosa. They were interested in assessing their community health sector. So they took a look at COPEWELL and said, here's a really good process and also a good measurement system in terms of the construction of the rubric itself. And they took the rubric and tweaked it and applied it very specifically to their community health sector. And so people are actually, I'm laughing because it's just people are so creative in terms of their applications of COPEWELL. Some people really like the objectivity and the precision and the standard measurement. For others, they see a lot of flexibility and they make it their own in a variety of ways. And I think you'll hear more about that on Thursday.
Now, there's one other point in what Monica was describing, and it's something that is a bit of religion with us, and it has to do with this distinction between routine community functioning and resilience. And one of the reasons we wanted to tease those two things apart is so that a community that really needed to strengthen its routine functioning would not have resources inappropriately allocated to disaster resilience per se, when the biggest way to build the ability to come out of the disaster the other side okay is to beef up daily functioning rather than resilience, this more abstract set of functions that only come into play during and after a disaster. And that's fundamental religion with us. And so part of the problem with a lot of preparedness efforts is that agencies, particularly beyond public health, say, I don't have time to think about disasters. I'm fighting the battle in the trenches every day. And our response is, we're right there with you. And building daily community functioning is critical to how a community comes out of a disaster. It's not just about building, quote, resilience, meaning the functions that only come into play during a disaster.
And one other thing I wanted to just add based on what Monica said, and I mean, she said it, and I want to just repeat it to make sure that everyone gets it, that this model is intended to be very flexible. So if it's too long for you, you can shorten it. If the wording isn't correct, isn't exactly right for your population, change it. This is something that, we found in this last, effort with our jurisdictions that are using it and giving us feedback, that some of them want to have permission from us to change it in a way that works for them. And we want to make sure everyone knows that you definitely have that permission, you have that flexibility, we encourage it. And so, it's something to make sure that, you don't feel like you just can't use this because it's not quite right. This is a great opportunity to take it and make it your own.
Thank you. Yeah, thank you for those insights. This is I think it's really great that you emphasize how these other organizations don't have to wait for a jurisdiction to start using COPEWELL. They can start it, they can kind of spur it and start working with public health agencies and things like that. That kind of brings me into one of our last questions, which we're talking about how COPEWELL is so adaptable and so flexible and all these things, but we wonder if specific local organizations like these NGOs or like a library or a faith-based organization, if they can actually adapt COPEWELL materials and tools for their own sort of internal resilience activities, or if y'all have heard of that happening yet, or anything like that.
You know, that's a great question. And I would encourage people to, for instance, take a close look at the self-assessment rubrics and at the prompting questions. So let's take libraries. They are a convening place. They are a source of information. They are a place where people can tap into the internet. So, and libraries, so I think sort of libraries can think about all the different functions that they serve and where they fit in. So a library may, you know, tap the emergency manager or the public health officer on the shoulder and say, you know, we would be a great place to convene some workshops to raise people's awareness about the factors that can influence our community resilience. Or we have a great collection of write-ups about disasters. We'd like to do a great exhibit around disasters, epidemics, and technological accidents and get a conversation started. How, you know, we can help you sort of, and so again, this is just off the cuff thinking, but I think whatever organization you are is do a really quick and dirty self-assessment, like what assets do we have that we can bring to the table to raise awareness, create a shared language about community resilience, bring people together. So that's for the library folks. Those are just some concrete ideas. Like the Duluth group did. The deliverers of social services wanted to make sure their sector was strong. And so they started with themselves, but they engaged other parts of the community. Like I said, after their conversations, they reached out to the transportation planner in order to make sure that their priorities were folded into the everyday periodic 5 to 10 year plans there are for the local transportation systems. So there's a lot of different places for people to plug into. And, you know, so definitely play around with the computational model and then dig into the prompting questions. And I think when you get to that level of granularity, you can go, oh, I have ideas, I have data sets, I work with clients who know this area, I serve clients who manage this area, and you can really plug in and see how you can be a champion. So I'll stop there and turn it over to Tara.
Well, actually, I think John may have something to say on this. Others have sort of thought through the COPEWELL model and said, well, I'm thinking about resistance, I'm thinking about recovery, I'm thinking about how those things go into resilience and kind of thinking through that model. So go ahead, John.
So I was just going to echo what Monica said, and Tara, what you've said in terms of flexibility. Now, at some point, if you change it enough, it's no longer COPEWELL. That doesn't mean you can't do that. The whole point of putting out the website is so you can take it and make it your own. You don't have to change a thing, but you're free to change as much as you want to change. And then it's just a case of whether or not you continue to reference it as COPEWELL or inspired by COPEWELL or something like that. But at the end of the day, we want what we've done to be used and to be useful.
Great, thank you so much. Do any of you have any lasting or last comments that you'd like to make before I end the Q&A session?
I guess I'll say one more thing that's just to pick up on what I just said. It's not about doing it right or perfect, as though such a thing as right or perfect existed when you're talking about community functioning and resilience, and how to strengthen it. It's about engaging in the process. And a lot of what Monica talked about in particular is about engaging in the process. And what we've seen time and again is that engaging in the process is its own outcome. And that it bears fruit just by the trying, just by the effort. And so we have tried to make the website user-friendly, and you don't need us, and you just start doing whatever seems accessible to you and what makes sense in your community. And so I think all three of us want to encourage all of you to just give it a try, and don't worry about perfect or absolute right, etc. It's the doing that counts.
And just to underscore this point that John's made, the very act of convening workshops to play with the computational model and produce these visualizations, these heat maps, or to carry out a self-assessment using the rubrics, and then to develop an action plan can itself strengthen resilience by fostering more social capital and cohesion and sharpening skills at group problem solving. So, I mean, you are becoming more resilient, as John was saying, through the act of coming together to solve a problem that is a priority for your community. So it's, that process is building resilience in and of itself, as John was just saying. So just let me get my yellow highlighter out and do that for what John just said.
Well, I just have one more thing to sort of add on to that, to say that, it is about getting people together. And this is actually a really good way. Sometimes disaster recovery, resilience, preparedness, sometimes that can be a difficult conversation to have for some folks. It can be political, it can be fraught, it can be finger pointing. And this process we have found from some of our users helps people get through that. They can have people in the same room who maybe on different sides, and this process allows them to sort of think about the actual topic, except for without blame. And so, just to say that, the process, the convening, the opportunity to bring people together in these conversations is really important. And this, is a great framework for that.
Thank you all so much. And thank you so much for highlighting how bringing everybody together is really like the backbone of these resilience activities and the backbone of what COPEWELL is trying to accomplish. But I think that does it for our Q&A session. So thank you all so much. Thank you to the COPEWELL team, Monica, Tara, John, and thank you for the questions from the audience. I'm going to go ahead and turn it back over to Jessica Schneider.
Thank you, Emily. And I want to echo her comments. Thank you very much to John, Monica, and Tara. This has been incredibly informative. And I especially love all the examples that y'all have provided about the flexibility of implementing COPEWELL and the types of organizations that might be involved in building community resilience as part of that process. So I know I'm very much looking forward to day 2, where we're going to hear more examples about implementing COPEWELL in local jurisdictions. So thank you again. As promised, we are going to initiate round 2 of our word cloud activity. Again, the purpose here is to see whether you all have had a change in perception about community resilience now that you've learned more about COPEWELL. So again, 1 or 2 words, please go ahead and submit to our poll, and we will share the results of this when we meet again on Thursday. So again, now that you learned about COPEWELL, what factors come to mind as necessary for improving community resilience to disasters? And while y'all are completing the poll, I also want to plug our survey that we will be releasing at the conclusion of day 2. This is just kind of a heads up that will be coming later. We really want to hear your feedback about COPEWELL, what you think, what you've learned, and also about this town hall. So please be on the lookout for an email from our team later this week. And now I will pass this back to Melinda for our final remarks.
Thank you so much, Jessica. Wow, I learned a lot today. I'm so grateful to all of the presenters and especially to the team that made this possible. One of the things that I've taken away from our town hall today is that resilience is really rooted in relationships and it's rooted in collaboration. And this town hall itself has been a collaboration. So I'd like to take a second to thank the Texas Rural Health Association for helping us to make this possible, and also especially to our COPEWELL presenters and researchers, particularly Monica, Tara, and John. Well, you all did a wonderful job, and I can't thank you enough. Don't forget that we will be back, not tomorrow, but Thursday, and we will reconvene to talk more about how COPEWELL can help your community to be more resilient and processes that you can use to make it effective for yourself, for your organization, and for those that you live and work with in your own towns and counties across the state and beyond. This is a really important tool, I think, and it has such flexibility that I'm really excited about different ways that it can and will be implemented. Another thing that's going to happen on Thursday is that we will be previewing a funding opportunity for representatives from Texas communities who want to, get busy and work with the Texas State Health and Resilience Research Center to build resilience in their own community. So stay tuned for that. I think that there's ample resources online that you can look at to learn more about COPEWELL, but I also think that coming back on Thursday will be very beneficial because the COPEWELL team is going to introduce us to people from several communities who have used it effectively. So that will be tremendously helpful to us. Again, I want to thank you for taking part in this town hall meeting today, and I look forward to seeing you on Thursday.